My name is Sydney John, and I will be presenting on child hunger in Venezuela. Due to the devastating economic crisis in Venezuela, which caused drastic inflation and a lack of food and supplies, the rate of malnutrition in children has been increasing at an alarming rate. As an economic crisis worsens in the country, so does the hunger crisis. When the world's oil prices dropped in 2014, the country began to lose a large amount of their income, seeing as oil was their main source. This caused hyperinflation, up to 720%, meaning that the cost of all goods drastically increased. It is estimated that the cost of a basic food basket is now 16 times the minimum wage. As prices for goods increase and supplies diminish, the cases of malnutrition increases. The fact that the Venezuelan government has attempted to cover this crisis for a period of time has definitely contributed to the negative impacts. By hiding health statistics from the rest of the world for years, in addition to creating a culture of fear for doctors to prevent them from including malnutrition on medical records, the government attempted to hide this crisis. While the president acknowledges the crisis now, he will not accept foreign aid. Often when other countries are faced with humanitarian crises, they rely heavily on international support. In this situation, by denying aid and claiming the crisis was actually caused by economic competitors, he is denying his people the help that they desperately need. According to Caritas, an organization that responds to humanitarian crises and conducts extensive investigative research on this issue, in 31 parishes studied throughout the country, over 8 in 10 households reported to be eating less than before, and 6 in 10 households reported that members are going with no food in order to give up their food to other members. According to UNICEF, as of August 2017, the rate of wasting and malnutrition were rising at an alarming rate. Of the population assessed, 15.5% of children showed signs of wasting, and an additional 20% of children were at risk of malnutrition. In terms of social determinants of health, socioeconomic status, the low income and poor families are being hit the hardest in this crisis. As the economic and social structure of the entire country is collapsing, these people have little to hold on to in order to survive. Access to health care. Medical institutions are typically beneficial in stopping public health crises. However, due to the economic crisis in Venezuela, the hospitals and clinics no longer have the ability to treat patients as they once did. Without infant formula and intermittent electricity, some hospitals are unable to keep newborns alive. Aside from a major lack of medication, institutions are now lacking basic necessities for sanitation such as gloves and soap. Furthermore, some hospitals are without water for extended periods of time due to infrastructure issues. Another social determinant of health is the neighborhood and built environment. When we look at potential interventions for this issue, some people can face issues with land access. If you have a lot of land, there's a possibility of growing food. Not everyone has that. Another issue can be the access to non-governmental aid organizations and local clinics. There are some organizations that do exist that can offer support, but not everyone has access to those. On the following slide, we will see a description of the issue through the scope of the socio-ecological model. Here we see the model itself. There's multiple levels, such as the policy, community, organizational, interpersonal, and individual level. Within each, there are many factors. At the individual level, we will see two factors. One will help and one will hinder the issue at hand. One factor that helps this issue is knowledge. Although there is a major lack of food and supplies in the country, parents are aware that they need to gain access to food and formula, even if hospitals do not have the supplies to help. By taking their children in search of formula shows that they are aware of this issue and how it can be solved. The attitude of the president of Venezuela, President Maduro, is hindering the improvement of the issue. By refusing foreign aid, the problem cannot be improved. At the interpersonal level, Family is a helping factor. In some instances, family members are eating less or giving up certain meals in order to ensure that young children are getting food. While this clearly is not a healthy or substantial solution, it may be prolonging some children's lives. A hindering factor right now is providers. Although in most cases, providers can help public health issues, due to the massive shortage of food supplies, there's not much that providers can offer the children in need. One potential issue with this is that perhaps this can create future distrust of providers and discourage patients from seeking medical attention. At the organizational level, community-based organizations are vital to smaller community. A prime example of this could be Caritas, which is an organization that creates community-run sites that are staffed with volunteer medics from the community. These sites offer regular checks, monitoring of nutritional status, natural supplements, and basic medications. Additionally, medics can offer to do home visits to identify anyone who should immediately seek help. In area with these sites, many children have improved and even recovered. A hindering factor in this case can be medical institutions. The hospitals and clinics no longer have the ability to treat the patients as they once did. At the community level, research institutions in this case are vital to discovering the truth about the extensiveness of the crisis, as the Venezuelan government, under the rule of Maduro, censors information. Researchers have the ability to dig deep and work with local doctors and health clinics to attempt to get as accurate statistics as possible in regards to the extensiveness of children dying and suffering from malnutrition. A hindering factor is the media. In Venezuela, it's a complicated factor as the dictatorship censors most traditional media sources, including TV and radio. The censorship of media is yet another way of the president to attempt to cover the crisis in his country, and the use of social media is potentially dangerous. At the policy level, national national legislature, in the form of the current president's opponents, offers a hope of change. These people do acknowledge a humanitarian crisis occurring in the country and want to liberate everyone from the Maduro regime. As time goes on, they become closer to gaining control. A hindering factor is the president himself. He is an incredibly destructive factor in hindering the improvement of this crisis, as he continues to deny and ignore the existence of the problem, and therefore preventing the necessary changes to be made. Proposed interventions. One potential intervention can be promoting the use of both lipid-based nutrient supplements, LBNS, and blended foods in the community sites. Based on a study, there is little difference between the two in terms of outcomes, but blended foods are cheaper, so that's probably a much better option in this situation, and they can be administered through local community sites. Integrated food security intervention. So this is essentially providing participants with the means to grow crops, such as an upfront cash donation, tools to farm, and seeds. This can offer food accessibility through diversifying sources of household income. They also offer nutritional knowledge from trainings and mentorships and home visits. And this program also ensures sustainable access to food by promoting long-term cooperative projects. A third possible intervention is the multi-type transfer program, such as in-kind assistance, in this case food baskets and vouchers. So a combination of the two of them can offer a variety of opportunities to families. So one outcome from the proposed intervention can be to increase food access and food security. One way we can do this is through household surveys. One particular way is the Household Food Insecurity Access Scale. Tool is a simple 9-question survey that can be easily administered to program participants and focuses on the anxiety and uncertainty about food, household experience with quality of food, and insufficient household food intake. An additional outcome is the increased knowledge and understanding of malnutrition and improved trust in methods to reduce it, increased number of parents seeking help for at-risk children. So again, this is opinion-based, so a survey would be the best method to collect this data. Additionally, in terms of the blended food intervention, this point could be expanded to see how many children are being brought to the community sites to receive the supplements and food on a daily basis. Basically, because this intervention is most effective when the children consume the supplement and food on a daily basis. The last outcome is the reduced number of children being admitted to hospitals and clinics for malnutrition. And the most basic way to do this would be to check hospital and clinic records. Potential challenges with the blended food promotion intervention, one issue is that people could potentially attempt to stockpile and sell the blended food and the LBNS. One solution could be to ensure that the children are taking their supplements at the community site itself and only give out one dose at a time. For the integrated food security intervention, the issue is the land requirement. A solution to this can be to screen communities beforehand and only select communities that can sustain this intervention. So that means that they have enough land to be able to grow crops. With the multi-type transfer program, an issue can be if the families are receiving enough resources to provide for everyone in their family or household. So as mentioned, one way to monitor this would be to collect data through surveys, and based on those surveys, the vouchers can be adjusted. Another consideration is that when there's such high inflation, the market values are incredibly skewed. So in a healthy economic situation, let's say $20 could buy an entire food basket, but when the inflation is at such a high level, only several items can be bought. So that's something to keep in mind. One key collaboration that can address all of these barriers would be the use of community health workers. They can be used and worked at all different sites and clinics and hospitals and really kind of face all of these issues head on. Right here we can see the logic model, all kind of summing up everything that was discussed in this presentation.